Welcome, and thank you for joining us. My name is Iola Forster, and I'm heading the Industry and Society Markets Unit at Karger Publishers.
And my name is Jonathan Gifford. I am the Healthcare Publications Manager at Karger Publishers.
You are probably asking yourself, bite me, create a menu of fair, balanced, and digestible information full of scientific flavor. What is that all about?
Well, the truth is, your audiences are hungry for knowledge, whether that's researchers, clinicians, patients, and their carers. And we would like to serve up some innovative ideas on how we, in collaboration with yourselves, can help you connect with those important audiences. The healthcare industry, in all its myriad components, lives and thrives on the creation, curation, and dissemination of knowledge. Researchers in drug development, clinicians seeking to update their skills and knowledge of a disease, and patients looking to understand better their condition, are all essential in advancing common goals such as diagnosis, disease management, and perhaps most pertinently, patient outcomes. But with so much information at their fingertips, how can we ensure the correct facts and knowledge are being delivered to the correct audience?
A recent example would be the devastating coronavirus pandemic, which we can confidently say over the past 3 years has affected every single individual listening to this presentation today. A cursory research online regarding the mRNA vaccine returned over 73 million hits. That's a mind-boggling number, and way too many results for any individual to confidently read, understand, and digest. The question is, can we tell of these 73 million which are credible in the context of our work in the healthcare industry? I wonder how many people have seen or been involved in the creation of an animation or video explaining the mRNA vaccine. Probably a number of you have. And likewise, have therefore understood that digital means, such as video and animation, can help your audiences digest the content in a simple way, as opposed to, say, reading thousands of different research papers. New innovative formats and digestible language, often found in animations, podcasts, video snippets, and infographics, can help transform this complex web of information into knowledge via easily understandable content for the end recipient. Pharma and biotech companies, specifically within medical affairs, are at the cutting edge of providing credible information to clinicians and patients alike.
Now, previously, back in the day, scientific information and communications was specifically produced with the clinician and researcher in mind. These were written in scientific language, which were usually only understood by that particular audience. The information was inaccessible and difficult to understand for anyone else who may not have a strong medical or academic background. Patients would visit their doctor, were diagnosed, and then informed as to what ailed them. This one-way flow of information, usually within a limited geographical reach, did not allow the patients to have their say, or even fully understand what was being said. It entirely depended on what the clinician knew and how they would explain it. So, as a patient, you had better hope that your doctor knew exactly what they were talking about and were the best informed they possibly could be. Nowadays, patients wish to better understand their condition. What can they expect? What treatments will they receive? How can they get the most out of their visits to the doctor? And maybe what lifestyle changes might they expect? Today, dialogue between patient and clinician is encouraged. Patients wish to shape their own outcomes by informing their doctor of their experiences and what they have read and researched. Open access or free to access information has become far more readily available to the average patient seeking to learn more. A benefit which in the past was restricted to subscribers or payers who most of the time were not patients themselves, but healthcare professionals. However, at the pace at which medicine is moving, for example, in drug discovery and advances in management and diagnosis, some areas still lack the information which clinicians and patients require.
In the modern age, a network of communities represents the cycle of knowledge, which is essential in improving patient outcomes. These communities, increasingly global in nature, can share information more or less instantly, beyond their group and beyond traditional borders, to shape and influence outcomes. Moreover, they have an investment in understanding the cutting-edge scientific information available to them today. What binds all these communities is a hunger for knowledge and advancement, which can only be achieved by having readily available and reliable sources of information. As a publisher, having the processes, experience, expertise, and networks in place, we can help deliver those reliable sources of information and thus facilitate the transfer of knowledge.
Those of you listening to this presentation will all have an audience you would like to communicate with. However, it's fair to say these audiences inevitably will differ, as will the purpose of communicating with them. Yet the starting point is the same: credible, scientific content. Therefore, the purpose of your communication, content, and audience will drive the format and the channels used in order to reach these key audiences. So, what formats are we talking about here? In our world of innovation and creativity, there always seems to be a new and exciting way to present content to your audience. It can be served up in a multitude of different formats to make the content more digestible for a specific audience. To communicate a message on modes of action, for example, one might seek to use a 2D or 3D video or animation, whereas a whiteboard video might be best to provide easy to understand overviews of a complex topic. Using and mixing formats to deliver a message keeps your audiences engaged without leaving them feeling overwhelmed or bored, while also presenting yourselves as thought leaders in this area. Before we decide on how best to connect with a particular audience, it is essential to consider the what, who, and how. First of all, what? What are you trying to achieve? Would it be to educate? Would it be to inform? Or perhaps you're seeking to publish some groundbreaking new data. Secondly, who? Who are you trying to reach and connect with? Are we targeting clinicians, so physicians, nurses, pharmacists, and other allied healthcare professionals? Are we targeting patients and caregivers? Or perhaps we would seek to target researchers working in a specific field. Finally, we must consider how. How will we reach them? What is the most engaging format for that audience? Would it be a traditional journal article in print? Or an interactive e-learning course, perhaps? What about video snippets and animations? Perhaps a simple infographic, both in print and digital, would be the best way. It's all about trying to find the right channels for delivery, depending on your audience's preferences, needs, and requirements.
With all this talk of a hunger for knowledge, how you take in information today is very similar to choosing your meal from a restaurant menu. Think about it like this. Everyone needs to eat, but the dietary needs of an Olympic swimmer will differ to that of a child, which in turn will differ to that of someone suffering with diabetes. What about if you're a vegetarian? You wouldn't want to choose the steak. Scientific and medical publishers, such as ourselves, have used the traditional model of journals, books, articles, and reprints to communicate our message. However, as time progressed, it has become glaringly obvious that not everyone wants to consume the information in this way. So, in the digital age, we have expanded this offering to encompass a wide variety of digital channels, which can suit every appetite for knowledge, whether that's a researcher, doctor, pharmacist, or a patient. However, what has not changed, the constant if you like, is that we thoughtfully create and curate content to your key audiences. It's just the way we make that information available that has changed, with an array of different formats and channel options. Unlike chefs the world over, we are more than happy to reveal our secret sauce, our secret ingredient. And it's simple. Karger has a heritage of over 130 years in the creation and curation of world-renowned scientific and medical content. Our experience in the medical publishing industry has allowed us to establish strong and meaningful connections with a robust network of communities, societies, and institutions to become a trusted and effective source of content. In order to really connect with your audiences, it is essential to begin with credible content. Then find the most effective and impactful way it can be delivered to your audience via the most reputable channels available.
If your audiences, whoever they may be, have an appetite for credible and digestible scientific and medical information, Karger can provide the menu and the secret ingredients to ensure their hunger for knowledge is satisfied. Thank you very much for listening.
Thank you.